Well, good Monday morning to you. Welcome to our Monday morning live edition of the Doctor's Nutrition Show. I'm your host, Jim Tabor, along with Drs. Jim and Janine Fox of Doctor's Nutrition, located on Calhoun Road in Gulfport, just south of Pass Road. We do this every Monday morning. It is a live show, and what we do is we talk about things that pertain to helping you live a healthier lifestyle. And we invite you to call in and ask any questions regarding our topic of the morning, 896-0713 or 800-349-0713. And you can pass your question on, or if it's anything pertaining to your health. This morning we're talking about autoimmune disorders. So what are autoimmune disorders?
Well, that's when the body kind of attacks itself. Yeah. In other words, it's our body, the immune system,
right,
tends to attack its own tissue. And it's been going on, it's been a lot of it going on over the years, and there's a lot of research in that area. And it's really kind of a fascinating thing, if you will, because there's so many. We've seen probably in the past 5-10 years we've seen a big uptick,
a big increase.
Increase,
yes,
right, big increase.
Is it because of the COVID, maybe?
Well, no, way before that.
Actually, it was before that, but there's no doubt since COVID we've seen more. Because really, if the body, our view for years has been the last 20-something years that we've been doing this, is that the body don't attack itself for no reason. Usually there's something in the body, whether it be a virus, a bacteria, a fungus, something that the body is trying to kill or attack, and instead it attacks itself. So it's really not something that the body should do, but it happens. And so there's no doubt with COVID, we have seen people afterwards have autoimmune, and they do know that. I mean, that's actually kind of one of the known things, and we've had a lot more people have really big inflammatory responses, and we think it is probably autoimmune, even if it doesn't test positive for the normal autoimmune problems.
Right. Like I say, we've seen a big uptick in it in the past. And we've seen it probably over the past, say, 15 years, 10, 15 years. More and more and more people coming in with various kinds of autoimmune things. You got to, with autoimmune things, you think about things like rheumatoid arthritis, lupus, etc. Those are the common things. There's so many of the uncommon things that just don't add up. In other words, you don't fit a textbook.
Yeah.
That's the key. It just doesn't fit a textbook, and yet they have all these inflammatory processes like she talked about, and we've seen so much of that over time, where people have, if you check their inflammatory markers, man, they've got all kind of inflammation going on in their body. But if you check for the quote-unquote known disease things, it's not there. So it's got to be something in that immune system. And there's a lot of research into it. Like her cousin is a researcher at the University of Colorado, and she's a rheumatologist there, and she's done a lot of work in showing how fungi or little funguses actually get in there and get in our tissue, especially in the lungs.
The lungs, her research is more about the lungs and rheumatoid arthritis.
Right.
She does a lot with that.
Right.
And she's been researching that for a long,
close to
probably 10 years, maybe?
Or more, yeah.
So the research is being done in medicine. We've been saying it probably for over 20 years, that we thought that that's what was causing a lot of the autoimmune problems.
Right.
And we have used things that way that long. So we've been doing it for 20-something years, where we've kind of taken a different approach. Because, of course, the regular medical approach to autoimmune is to use immunosuppressants, things that suppress the immune system.
Right.
And yes, suppressing the immune system stops the response because the body stops attacking itself. But at the same time, immunosuppressants will stop attacking other things too. So the bad thing is it puts you at risk for other things. So naturally, we just do it a little bit different, go a different route on trying to keep it controlled. Now, we're not saying every person out there with autoimmune can take the natural stuff and it controls it.
No.
But we have many people where it can. And especially when you get the mild ones and you get the ones that don't really fit any one thing. Like they're told, oh, we don't know what it is. And we see a lot of that. But those people that we hear that from, they do respond to what we use naturally for autoimmune.
Yeah, they do. It's really kind of interesting, and we get a lot of people. Most people that show up on our doorstep, they've been down the road. I mean, they've been everywhere. We get them typically when they come to us. We're kind of a last resort, so to speak. I mean, like, okay, we've tried everything else. what the heck do you got? And that's kind of where they show up on our doorstep. And so they've been tested 7 weeks from Sunday, which is really good because, I mean, they know, okay, we know what it's not, that's for sure. But at the same time, they still got a problem. The patient still has symptoms, and you can't just sweep it under the rug. They've got symptoms. And, we go back to that inflammatory response. A lot of times, if we can just get the inflammation under control, whatever we got to do to get that under control, something's going to get better, or at least maintain and not get worse. And so we've looked at it for years as just controlling the inflammation, and even the people in the alternative medicine field have been the same way. Like she said, 25 years ago, there was this, or more, the theory was something has to be in that tissue to make the immune system try to attack that tissue. So if it attacks your lungs, then there's something in that lung, and like her cousin's research has kind of showed, it could be a fungus of some sort. And sure enough, there's something there. And things that hide, for instance, we get an awful lot of people with autoimmune thyroiditis, called Hashimoto.
I was going to say, I know y'all have talked about
that's a very common.
Hashimoto's disease.
That one's common. We do see a lot of people with that.
It's unbelievably common.
So there's different types of autoimmune disorders.
Oh, definitely.
Oh, yeah.
There's a lot of, tons, and I think there's ones that haven't been named. I think there's things out there, and people say, well, it acts autoimmune. It looks like it's an autoimmune, but yet you don't test positive for any of the normal autoimmune problems. I think there's things that don't have tests yet.
What are the most common, though?
Well, actually, probably Hashimoto's is one of the most common.
Probably one of the most,
but rheumatoid arthritis and lupus are two of the big ones, and you can test for those. The good thing is there are tests for those. And so there's a lot of things that you can test for, but sometimes the confirmatory tests don't even show that it's there. So it gets complicated when it comes autoimmune. But you can do something about it when you have weird symptoms and there hadn't been any help. Now we do tell people, if you do have something like that and you have had tons of testing, when you come in to see us, bring it with you.
Yes.
There ain't no sense in testing the same thing over and over and over. You want to bring in what you've had done, and we can look at it, and then we can kind of see if there's anything that we would test.
Right.
And as a whole, like we've always said, you want to get overall healthy. It's not just about one area. And normalizing the immune system is a big part of what we do. You don't want to shut it down, but you don't want to make it overactive either. You don't want to go do immune boosters at the same time, because that will make it worse. So that's what a lot of people do. I'm going to go get something to boost my immune system, and then it actually makes their body attack themselves worse.
Okay. 896-0713 or 800-349-0713. We're talking about autoimmune disorders this morning. Or if you have any other questions regarding any health issues, feel free to pick up the phone and give us a call. We're going to take a break, and we'll be right back. And welcome back to our Monday morning live edition of the Doctor's Nutrition Show. We're talking about autoimmune diseases right now. Can something trigger an autoimmune disease, like stress?
Oh, look, stress can pretty much do anything adverse to the body, let's put it that way. So yeah, stress can do it. We've seen things, before, things like, for instance, patient has a surgery, and it's an elective surgery even, for something that just needs to be fixed, whatever. And afterwards, surgery was fine, they recovered from that okay, but they've got all kind of really weird symptoms. And you think, well, maybe it's, back to the anesthesia, but hey, sooner or later you get over anesthesia. And it's just, these things linger. Yeah. And so, a long time down the road, because of that stress, because the surgery is a stress. I don't care what
We've seen people after car accidents.
Car accidents, right.
Or emotional traumas. You see a lot of, stress is so many different things. It's not just one thing.
Right.
But we've seen it after all that. Like I said, accidents, emotional stress, surgeries, and then just day-to-day, somebody that's had lots of just regular stress. And so there's no doubt that makes the body it might have already been there. It might have been dormant. And when you start looking at like viruses can lay dormant. And I always tell people, it's kind of like, if you think about it, people all know about chicken pox. And if you had chicken pox, then later in life, if you get run down and stressed out,
you get
what
shingles.
comes out? Shingles.
Shingles, yeah.
So when that same thing happens in any of those viruses, Epstein-Barr virus is another really big one.
Bad one.
Epstein-Barr caused a lot of problems. And especially with Hashimoto's, there's a lot of research that shows that's probably one of the #1 things they think might be the cause of Hashimoto's is the EBV is actually in the thyroid. And if it, the body tries to attack the EBV and it attacks the thyroid itself. So EBV is another big one, which is mono when you first have it. And then you might not even know it's reactivated. So you can look at things like that, and we do a lot of EBV testing, and we do see a lot of them that's reactivated after years. And no doubt, being stressed and run down is what actually makes it worse.
And what's really interesting about mono, or the Epstein-Barr or EBV, what's really interesting, a lot of times you'll ask this person, "Did you have mono?" No,
nope,
never had it. But you test them, and they not only had it, but now it's reactivated. There's a way to test where you can see whether it's an old virus or whether it's something that's reactivated.
Or whether
I remember when they used to call mono the kissing disease.
Yeah,
well, yeah, that was it. Yeah, right. But there's been so many people that swear, I never had that. And yet when you test them for it, yeah, okay, well, you had it and it's reactivated. And now they've got this real problem that we got to deal with. And it's all from something, they didn't even know they had it. I said, well, you might have had flu-like symptoms for a day or two. Very mild, actually.
Or real sore throat.
Or real sore throat for a day or two. I thought it was strep or something. Who knows?
Yeah.
And sure enough, that's what we wind up with.
Well, we got a caller with a question. What would you recommend for inflammation of the spine?
Same thing you have for inflammation anywhere, really. You have to work on the inflammatory process. And one of the best things that we've seen is that SPM.
SPM.
And within the past, say, 5 years, the SPMs, and I think we've talked about those before on the show. It's a specialized pro-resolving mediator, and that's when our body actually makes those things if we give it the right raw materials, which are the omega-3s and all that good stuff that we talk about all the time. If we don't, body can't make it. But that's for probably one of the best things, because inflammation of the spine is just like inflammation anywhere else, and once it becomes chronic, it can cause a lot of problems.
Now you can also do, we have like Phyto-4.
Yes.
We use that a lot in people that have just like a back pain, which is, I guess that's what you're talking about with inflammation of the spine.
I would
probably
think, yeah.
like more like a back pain or something like that. It is more of you can use it as needed. SPM has to be taken day in, day out, really, to get the effects you want on it.
Right.
Phyto-4 can be taken as needed, and it's quicker acting, so you can definitely tell a difference. And it has 4 different ingredients. It's hops, ginger, boswellia, and turmeric or curcumin, which any of those alone also help with inflammation. So we have the curcumavale, which is the curcumins by itself. So there's a lot. There are so many natural compounds that are anti-inflammatory.
Right.
And we run into a lot of people that can't take the prescription anti-inflammatories due to a kidney disease or some reason that they can't do it. They've been told by their doctor not to take those. The natural stuff is different. It is not harmful to the kidneys. It's not like the medications that are anti-inflammatories, where they can affect the kidneys and burn the stomach and a lot of that stuff. So there are alternatives for inflammation, and we use that same things we just talked about for autoimmune problems.
Right.
And we've seen when people have like the C-reactive protein and the SED rates sky high, which you will see in autoimmune diseases, there is no doubt that SPM lowers those markers better than anything we've ever used. I can say that. I mean, and that you can measure.
Yeah.
It is measurable.
Yeah.
So that's one reason we do lab work. I mean, we always talk about our lab work because you can measure, and you can measure, is it coming down? It's not just somebody's, oh yeah, I feel better. It is this working? So we've had many people that it's brought the levels down. And our panel that we look at to see about the inflammation markers, and it does test for the common autoimmune, is our pain panel. And we call it our pain panel because with autoimmune problems, you tend to have a lot of pain. It hurts.
Yep.
Now, the pain panel checks other things too, like it does check for gout, because gout is not necessarily autoimmune, but it makes a lot of inflammation and pain as well. So it checks for that, and it does all your basics. So it looks at all the basic stuff. It looks at rheumatoid arthritis, checks for ANA, looks for muscle breakdowns. There's a lot of things that it checks for.
Right.
But it does do the SED rate and the C-reactive protein as well.
Okay.
So there are panels that you can do to just kind of see if you're having weird abnormal pains, especially ones that move.
And I was going to ask what kind of symptoms can come with an autoimmune disorder, that kind of maybe red flags that you should watch out for.
I would say fatigue is one. Fatigue and pain, but really one of the things is that the pain can move, and it is really strange. I've had autoimmune problems my whole life pretty much. I keep it controlled, but every once in a while, when you have something, you can have a pain in a joint that feels like it is severe, almost like you've sprained it or broke it or something, and then 30 minutes later, it's gone. And it might be in a different joint, like 3 hours later, and it's like
tomorrow it's a different knee.
It makes you think you're going crazy, but that is kind of some of the things autoimmune does. Is it can move, it can change.
Okay, all right. 896-0713, 800-349-0713. Our phone lines are open. If you have any questions regarding autoimmune disorders or any other health-related questions, please feel free to pick up the phone and give us a call. We're going to take a break, and we'll be right back with our final segment and with this week's special. And welcome back to our final segment of the show this morning. Let's go ahead and look at what this week's special is from Doctor's Nutrition.
Yeah, it's our olive oil, and it's an olive leaf extract. We've had it on sale before. A lot of people take this, and a lot of people get good results with it because it is an antiviral, antifungal, even has some antibacterial properties as well. And it really does a great job of keeping it doesn't cause an immune response as far as in stimulating the immune system, but it helps the immune system keep things under control, so they don't get carried away. That's the key.
So it's not an immune stimulant. No. Like I said, you don't want things that stimulate the immune system, like echinacea and golden seal and things like that when you have an autoimmune problem. You want something that actually normalizes, and that's one thing. Olive oil actually helps the body suppress some of these things that are causing the problem. And we say suppress because it's not necessarily it gets rid of them, because viruses are really hard to get rid of. You can suppress them. You can help keep them controlled where they don't cause problems. And that's and olive oil is also used during this time of the year. One reason we decided to do this is olive oil is a great thing to have in your medicine cabinet, even if you don't have an autoimmune problem. It is, if you start feeling something coming on, take it. If because like I said, it is kind of a catch-all. And olive oil also has a lot of good research for the heart and how it helps the blood pressure both high and low. So it normalizes the heart as well. So it normalizes the immune system, it normalizes the heart. It's just definitely good for overall health. So that's why we decided to put olive oil on sale, because it's pretty much one that almost anybody can take.
Well, one of the things that y'all talk about a lot is a good diet. Does diet play a role in avoiding a autoimmune problem?
We should. One thing I didn't even think yet to mention is gluten. A gluten-free diet is essential if you have an autoimmune problem. No doubt there's been a lot on showing how gluten can trigger the inflammation and increase the immune response. So there's the one diet for actual autoimmune that's really good. It's hard to follow. It's called the AIP diet, and it's the autoimmune paleo diet. And it is stricter than paleo. So it's not just, but it is a grain-free diet, it's a dairy-free diet, and that makes a huge difference. Because I've had a lot of the people that come in, especially like we see a lot of rheumatoid arthritis. We can give them the supplements we use, which we use the olive oil, we use the SPM, we use Pernimax when it comes to rheumatoid. We have a lot of different things we use, but if they don't follow the diet also, it does not work near as well. Now, if they just follow the diet, it doesn't work as well either. It almost takes the two combination. So I've had a lot of people over the years that's done the two together, but diet is essential. And there's no doubt, like we always said, sugar is not good for any of it.
Pro-inflammatory.
All right, a caller has a question. I've been having issues with nosebleeds as of late, and also a pain in the heel of my foot. I was wondering if these two were somehow connected and what I could do about it.
Wow, that's hard. That's a hard one to answer.
That's a tough one.
The pain in the heel of the foot almost sounds like a bone spur or something.
Well, it could be like a spur or something like that in one of the ligaments there. And when you start talking about nosebleeds, there's a lot of things that can cause that. Have they changed any medications?
Right, that's what I was.
That's one of the first things you always ask. If you've changed any kind of medications, some of those medications tend to make you bleed just a little bit more than others. Or maybe they've just start taking something over the counter that they don't even think about.
Yeah.
And so that may be a thing. So we have to really dig in when you start talking about nosebleeds, and they're a sign. Pay attention to it. That's a sign. Something's not right.
Something's wrong.
So we got to pay attention to it. It's red flag.
Now, whether it's connected to the heel, who knows? That's hard to answer without a lot of information in front of us.
Yeah.
That's why, like I said, without doing testing, you really can't tell sometimes what's going on. And that's why we always recommend getting testing. If you haven't had testing, go get testing done.
Right.
If you have had a bunch of testing, bring it to us, let us look at it, and then we can maybe give you a little bit better of an opinion.
Or decide, okay, well, they haven't looked at such and such, some other area. And because, if you think about it and say, well, could be something else, okay, let's look at that. And if it hasn't been looked at before,
and then if you hadn't had an X-ray of that heel, that's one of the things.
That's one of the first things for the heel.
For the heel,
right.
Exactly.
Now the nosebleeds.
You just have to look at a lot of other things.
I guess one of the big final questions would be: can an autoimmune disorder be cured?
I would say
cure is a big word.
No.
That's the biggest four-letter word in the world. It really is. Control.
You can go into remission.
Yeah.
Would be the word. But to me, people that have it will always be prone to getting it again if they don't keep doing what they're doing.
I guess that's like
the
chicken pox thing,
Yeah,
exactly.
System.
You have to stay on top of it because yes, you definitely have it where it can go into remission. And MS is another one that's autoimmune. MS can go into remission, and a lot of times though it don't. So MS is something that we see a lot, and we're seeing a lot more of MS as well. It's just we're seeing a lot more of all your autoimmune. Of all kinds. I mean, autoimmune hepatitis,
scleroderma, you name it.
There's so many out there. Sjogren's.
Yeah.
There's so many different autoimmune diseases
that are popping up more so.
Well, they've been been around for years, but we keep seeing more and more of it.
Yeah, right. I mean, I think the key is, like I say, it's been in the textbooks for like 100 years, but it was one of those things. Yeah, you really didn't see that much of it, and now you're seeing it more often. Confirmed more often. I mean, it's not just like, it could be. No, these things are being confirmed. And sure enough, it's there. And
we blame that on lifestyle?
Like I said, when you say symptoms earlier, we left out probably 1,000 symptoms because honestly, if it's thyroid,
we don't have time.
We don't have that time.
If it's thyroid, it's all your thyroid symptoms. If it's
the
autoimmune hepatitis, it's going to be your liver symptoms.
Yeah.
If you can have almost any symptom can do it, but we normally do hear pain of some sort, or on a lot of them, but not all of them, because like thyroid don't have necessarily the pain with it. So everybody, it's all different, but just any symptom just about can be a symptom of autoimmune.
Yeah.
It's very vague sometimes.
It can be very vague, and a lot of times that and we see this all the time. They'll tell a person that you've just got fibromyalgia. I mean, fibromyalgia is the biggest wastebasket term.
And I do think some people with fibromyalgia diagnosis do have autoimmune.
We've seen that.
And I see a lot that I think fibromyalgia can be a lot of different things.
Right.
But I do think autoimmune is one of them.
And of course, as you said, the best way to find out is to come in and get that pain panel done.
Yeah, and
that's a start.
That's a start.
And
that might not tell you everything either, but you got to
start.
That's
where
start somewhere.
You got to start somewhere.
Yeah.
That's right.
Exactly.
That's right. Okay, well, next Monday is the first Monday of the month of November already.
No, I can't believe it.
Thanksgiving right around the corner. And so it is an open line Monday, which means you can call in and ask questions regarding anything about your health. If you want to email me ahead of time, you can email that to jtaber@wlox.com. Find a lot of great information on doctorsnutrition.com as well, and their Facebook page. Doctors Nutrition Facebook page. Thank you so much for being here with us again this morning. We hope you have yourself a wonderful week, and we'll see you again next Monday morning here on WLOX CBS.
For more information on highlighting your business and services on Healthy Living South Mississippi, contact Jim Tabor at 896-1313.